How do you help address the challenges that chronic pain that are unique to chronic pain patients?
I don't I don't work with people that are on opiates or benzo. Well, I have some people that I do. That's not actually true. I work with some people as a coach as they're coming off, but mostly in recovery. I have mostly people in that are have benzodiazepine in their system. I work with those because if they're doing a taper, they have all kinds of anxiety problems, and I know that space really well because I lived it, and so I'm a great coach in that space. That anxiety, a lot of that has to do with, yes, it's physiological, and they don't have a breathing, conscious breathing practice, and that is very helpful in that space. So um, so the negative mind, the habits, the biochemical soup that creates that as part of it. Also, I'm not a nutritionist, but I do point them in the direction of working with a doctor or nutritionist, some naturopath, functional doctor, something to help them with their diet to make sure that it's clean and anti-inflammatory, sugars out of it, that there's plenty of water on board, that kind of thing. And I bring in what's the other thing? So there's the negative mind, the chaos in the brain. It's just I can't remember what I just did. Difficulty focusing. So we bring in meditation as a huge antidote to that.
So mindfulness and meditation seem to have a lot of role in.
Yeah, and it's tricky because the nervous system of a chronic pain patient is hypervigilant, which means it's just tense all the. And I know this, I lived it. It's just tense all the time, and so putting them in a meditation practice is
Right.
which is why I do the trauma informed, because if you ask them to sit still, that can be traumatic for them.
Trigger, yeah.
So we have to. So I bring in chanting and a little bit of movement, breath work. I make sure that they're moving somewhat so that the body's not not doing this. So they have
Yeah.
energy has somewhere to go.